Hi, I'm Dr. Caroline Tadros, a gastroenterologist at Kaiser Permanente, and today we're going to talk about a common condition, GERD, or gastroesophageal reflux disease. This is also known as heartburn or acid indigestion. So what is GERD? Typically, GERD is a burning sensation within the chest or the upper portion of the abdomen. When you swallow food, it travels down a tube called the esophagus and lands in your stomach. Normally, the sphincter at the bottom of the esophagus acts like a trap door or a valve. It lets food go into the stomach and then closes to keep acid from coming back up to the chest. As we get older, the sphincter can naturally weaken, and stomach acid can sneak back up into your esophagus. There are things that we eat and do that can increase this. In addition to the sphincter, our diaphragm also provides anti-reflux benefits. What can cause GERD? There are quite a few regular activities that can bring on GERD symptoms. Eating foods that are spicy or high in acidity like citrus or tomatoes, chocolate, peppermint, and caffeine. Being overweight or any condition that increases the pressure below the diaphragm will increase your risk of developing reflux. This is why pregnancy can also cause symptoms. Smoking is another cause, as it can impact the sphincter, causing acid reflux. Eating a large meal or lying down soon after eating can push acid back up into the chest. Some people only get heartburn occasionally, like after a big meal, but with GERD, it can happen frequently. What are the main symptoms you might experience? The most common symptom of GERD is heartburn, which is a burning sensation that you might feel in your chest or upper abdomen. Even if you don't experience heartburn, you may have other symptoms such as trouble swallowing, a persistent dry cough, constant throat clearing, exacerbation of asthma if you have it, or a globus sensation, which is the sensation that there is something sitting in the back of your throat that you just can't clear. How do we treat GERD? The good news is there are many things that you can do to manage your GERD symptoms. Here are some common treatment options. First, there are some basic lifestyle changes you can commit to that can lead to improvement of your symptoms. Try to avoid foods that trigger your symptoms. Don't lie down for at least 2 to 3 hours after eating. You are more likely to develop symptoms if you eat and then lay down. And if nighttime symptoms are a problem, try raising the head of your bed. Propping yourself up with pillows will likely not be enough, but you can purchase a wedge from a medical supply store. This is effective because as you are slightly elevated, gravity will tend to pull the fluid in the stomach down closer to the bottom and away from the base of the esophagus, making you less likely to have the acid enter the esophagus and cause your symptoms. Also, it's very important to maintain a healthy weight. Losing a few pounds can be very helpful, as this will decrease the pressure below the diaphragm. Over-the-counter medications can also be helpful, such as antacids. These are things like Rolaids, Maalox, and Tums, and can give quick relief by neutralizing acid. These will treat your symptoms, but will not stop reflux from developing. Histamine blockers. This is something like Pepcid. They are very effective and can provide relief to approximately 50% of patients with acid reflux. The advantage is it works very quickly. Typically, you'll see benefit within a few days. They may be ineffective if you have severe symptoms. Proton pump inhibitors, or PPIs, like Prilosec. These medications are the most effective class of medicines to help decrease the volume of acid released in response to eating. The downside to these medicines is that they can take 4 to 6 weeks before you start to see the full effect. They also need to be taken 30 to 60 minutes before eating in order to be effective. If over-the-counter options don't help, your physician might prescribe stronger versions of PPIs or histamine blockers. In some rare cases, if medicines and lifestyle changes don't work, surgery might be an option to tighten the sphincter and to stop reflux for good. But this is usually a last resort. When should you see your doctor? You should contact your primary care physician if you have any of the following: difficulty swallowing, It's important to let your primary care physician know because this could be a sign of scarring in the esophagus or ulceration, and they may need to make medication adjustments to alleviate your symptoms. If you've had reflux symptoms for 5 to 10 years and you are an active or former tobacco user, if you suddenly develop symptoms and if you are 60 or older, if you experience sudden weight loss, if you have any doubt about your symptoms or if you need help managing them, please call our KP Advice Line. We're here to help you figure out what's best for you. It's also important to know that if you have pain that moves to your arm, your jaw, or is associated with shortness of breath, dizziness, lightheadedness, or nausea, please call 911. Your primary care physician is here with you every step of the way, and they work very closely with specialists to help manage your symptoms and provide excellent care to alleviate your symptoms. Thanks for watching.